The member for Solomon has the call.
I rise to add my voice to the statement of indulgence on the 10th anniversary of the Bali Bombings. As a lifetime Territorian, I have travelled quite frequently to Bali. It's a shorter flight to Bali than it is to either
The capital city. Well, to any other capital city in Australia. And also, Madam Deputy Speaker, it's okay. It's a lot cheaper to fly to Bali than it is to any capital city. But it's because of this reason that Bali is quite a popular holiday destination amongst many Territorians. And it's not uncommon for people from my electorate to have travelled to Bali for more than 5 to 10 times. I myself have been there at least 15 times since the first time I travelled there in the late 80s. Like all Australians, I was absolutely in shock when I first heard the news of the terrorist attacks in Bali, a place that I know so well. It really was a wake-up call for all Australians. Terrorists had just attacked us so close to home. These terrible bombings where 202 people were killed, 88 Australians and 38 Indonesians among many of the victims. Hundreds more had been injured. A holiday to Bali will never ever be the same from that time on, because forever in the back of the minds of travellers is the thought of another attack. That innocence had been lost. As the member for Brisbane said, that my electorate had a bit of involvement after the bombings. And it's often said that the true human spirit comes out in the most tragic of times. And I think that this is true of the Bali bombings. In the immediate aftermath, we heard stories of bravery, mateship and sacrifice. And one of the stories I'm most proud of is the story of the Royal Darwin Hospital. The Royal Darwin Hospital is, as many know, the major public hospital in the Northern Territory, and it happens to be in my electorate of Solomon. It services the needs of people in Darwin and Palmerston and indeed the Northern Territory. Now it even plays a role nationally and in fact internationally. After the bombings in Kuta, Royal Darwin Hospital was put on notice to prepare to receive the injured because the hospital in Bali was not able to cope and was resourced adequately to deal with the hundreds of injured people from the explosions. We've heard stories of how staff were called in to assist in the preparations. 2 surgical wards on the 2nd floor were cleared, with patients being sent home or relocated within the hospital or transferred to the private hospital. Some of the more serious cases were wanting to give up their beds for the bombing victims, but because of their injuries were forced to stay. By the end of the emergency, 63 critically injured patients had been treated in Darwin. The staff at the Royal Darwin Hospital and those who came from the interstate to help performed well above expectations. And as a community, we were so proud of what they achieved and how hard that they'd worked. 16 Territorians were recognised with honours for their work in the response. Some of these staff include Dr Didier Palmer, Dr Gary Lum and Dr Len Nataris. These 3 doctors were instrumental in the setup of the response, and they continue to play important roles in the Royal Darwin Hospital today. Dr Nataris is now the Executive Director of the National Critical Care and Trauma Response Centre. Dr Palmer is the Director of Emergency Medicine in the Royal Darwin Hospital, and Dr Lum is the Assistant Secretary of the Health Emergency Management Branch in the Office of Health Protection. These 3 are just 3 of the many remarkable people who worked tirelessly over those critical 36 hours looking after the victims of the Bali bombings. Recently, Dr Nataris commented that the Royal Darwin Hospital dealt in 36 hours with more casualties than any single hospital dealt with in either the 9/11 or in the Oklahoma bombings in the United States. I thought that was a pretty impressive comment to make. It's a truly outstanding achievement all Australians, not just Territorians, can be proud of. One of the few positives to come out of such an awful act of hatred is the National Critical Care and Trauma Response Centre. The Response Centre was set up in 2005 with funding from the then Federal Coalition Government. According to the National Critical Care and Trauma Response official website, the function of this centre is to ensure enhanced surge capacity for the Royal Darwin Hospital to provide a rapid response in the event of a mass casualty incident in the region. As a result of the Critical Trauma Response Centre has channelled significant funds into Royal Darwin Hospital to enhance the capacity of the hospital's surgical and trauma divisions. Additionally, since its creation, the Response Centre and Royal Darwin Hospital have dealt with the second Bali bombings in 2005, the East Timor unrest in 2006, the attempted assassination of East Timor President Jose Ramos Horta in 2008, the Ashmore Reef CF-36 incident in 2009, and the Pakistan floods in 2010. Locally, the Centre and Royal Darwin Hospital have been involved in responses to the Cyclone Helen and the Ghan derailment and the petrol bomb attack on the TIO office in Darwin City. In recognition of the 10th anniversary of the bombings of Darwin, the National Critical Trauma Response Centre held its conference recently, and it was the War and Disaster 2012. As part of this conference, a gala dinner was held on the Thursday night with former Prime Minister John Howard as the keynote speaker. Former Prime Minister John Howard recognised the Royal Darwin Hospital's effort and response to the attacks as a remarkable achievement, saying the response, particularly that organised through the Royal Darwin Hospital, was a triumph of what I think I can describe as the gentle efficiency of the Australian people when faced with a great crisis. Mr Howard acknowledged that the terrorists had failed in their attempt to drive a wedge between Australia and Indonesia. I think one of the best examples of this failure is the success of the relationship that now stands between the Royal Darwin Hospital and the Sangla Hospital in Bali, a testament to the strengthened relationship between Australia and Indonesia. Recently, I tabled a private member's motion to acknowledge the work done by our medical professionals across Australia in the wake of the Bali bombings. I'm happy to say that I have secured support from my coalition colleagues and am working to secure support from the Labor government so that we can debate this motion. I think it's important to recognise the contribution that these people made in 2002 and continue to make today. The thoughts and prayers of the people of Darwin and Palmerston are with the families and friends of those 88 Australians who died and the many more who were injured. We must also take time to acknowledge our friends in Indonesia who also suffered a great loss, but who continue to offer the hand of friendship to Australians and who stand with us against the menace of terrorism.
Order.